All right, hello and welcome back to the Lunch and Learn session sponsored by ITS and Human Relations. I'm Brian Krusniak. I get to be one of the hosts, and for today, the only host for the Lunch and Learn. Joe Vincent is sunning himself out in Arizona at the Arizona campus, so I'm going to be flying solo today. Before I introduce the guest, I want to kind of reiterate that you guys can all share your comments, thoughts, questions by using the chat in the live.atsu.edu. So post questions, thoughts in there, and we'll try and work them into the session. We've got a great session today. Today's session is going to be talking about technology and teaching. And so there are lots of ways that technology is embedded in teaching and learning. What we're going to talk about today and focus on today is more visual type teaching and learning components. We're going to talk about anatomy and what we're doing in terms of 3D imaging with anatomy, and then also go into a little bit of simulation and talk about simulation tools and technology there. And then we'll kind of wrap it up with 3D printing and kind of how that's changing the technology space in teaching and learning. So let's go ahead and dive in. To start, we're going to start kind of with anatomy. And we're going to start here on our Missouri campus. We've got Jeremy Hauser. And Jeremy is the KCOM Associate Professor in Anatomy. And he'll be with us. Hi, Jeremy.
Thank you.
Good to have you here. And then out on the Arizona campus, we have Dr. Jay Crutchfield. And Dr. Crutchfield is the Anatomy Chair out in Arizona. Hi, Jay.
Hi, everybody. Thanks for having me.
Oh, great to have you here. Yeah, thanks. It's super. And then also to kind of help us round out some of the services that we have available for anatomy, we've got Mike Kronenfeld, and Mike's out on the Arizona campus as well. Mike, how you doing?
Good, good. I enjoyed my visit to Kirksville last week.
All right, good. Yeah, the weather's nice, so thanks for leaving the nice weather here. Appreciate it. So that kind of rounds out our anatomy type group, and then more after the break, but I'll introduce them now. We have a couple of people who will help us with simulation, and we'll talk about simulation both in terms of medical programs and dental programs, or a little bit more focus there. So we'll start here in Missouri, and we've got one of our students with us. Ethan Jaeger is with us here, and Ethan helps out in the Performance Assessment Center. Mm-hmm. So. How you doing, Ethan?
I'm doing well, thanks for having me.
Great. And then out in Arizona, we have Dr. Klud Razoky. And Klud is responsible for the simulation center out for the ASDOH students. So hi, Klud.
Hi, how are you? Thank you for inviting me.
Great to have you. Thanks for joining us.
Thank you.
Well, let's start and talk with anatomy, because anatomy is kind of one of the core features of things that we do for almost all of the programs. So Jeremy, maybe you can kind of start us with what types of programs you guys use within, and what types of courses some of those tools are used.
All right, so yeah, KCOM Anatomy, at least because we're separate than the Arizona campus, really focuses on instructing the first year medical students in anatomy, but that also incorporates neuroscience, histology, embryology, and radiographic or medical imaging characteristics of anatomy. So we have our hands into quite a few areas, but you know, our main dominion is the gross anatomy course that we instruct on, and so we utilize technology in a variety of ways, both in the lecture and in the lab. But in the lab, there's two key components of that you know, personally I like to focus in on, and that is, you know, how we get the students to dissect the cadaver and understand that process, and really understand the relationship of the anatomical structures they're dealing with. So one of the newest things that we're doing, and this is pretty much on my back, I do this on a regular basis, is I write an online dissector. And this is the old way of doing things was very paper and pencil type and textbooks, and that interface is not modifiable. So with this new online dissector, we're able to modify and adjust and personalize the instructions for the students, whether they're on a male cadaver or female cadaver. If we want to have them do a variety of different dissection cuts, we can get them to do that through this process. And the new system's so modifiable. I can make it, you know, use different fonts and hyperlink to videos and do that type of thing. So we can really enhance that learning process.
So really there's the lab, there's the lecture component, and they're combined in terms of the tools that the students can use?
Oh yeah, we try to integrate them as much as possible, and too often the student wants to separate lab and lecture because they're different grade components, but
Sure.
in reality, I mean, they should integrate and be choreographed along, and the technology definitely helps in that.
And Jay, what about you guys in Arizona? Do you also kind of separate the lecture and the lab component, or are they a little bit more integrated with the facility that you've got in Arizona?
So thank you. That's a great question. We do our best to try to integrate all of the classical anatomy information initially into a lecture, so then the students can take that information either to the cadaver lab or follow it up in our virtual anatomy lab. Anatomy is highly visual. So when we talk about bringing technology into something like anatomy, we're talking about a pretty expensive endeavor because the visual aids require very high resolution, a special set of imaging, and we've done our best here to not only reinvent our cadaver lab, but also the creation of the virtual anatomy lab.
And maybe tell us a little bit about what the virtual anatomy lab looks like.
So the virtual lab is, if you look at it from the outside, it looks really nothing more than a computer lab. We have 57 computers, and we also have a 3D projector. And this technology is used on a main podium computer, and all of these computers are different than the computer that you're going to go and purchase at Best Buy or online. The computers that we're using, even though from the outside it looks like a computer room, the computers that we're using are very up to date. They're state of the art. We have really some pretty expensive hardware, video cards, and just to give you an idea, the main computer which runs our 3D programs so that the students can actually put on 3D glasses, just like if you went to a movie theater. Our main computer, the video card for it alone was about $1,500. So the price of a single computer that you would purchase for home is the price of only one component of the mainframe computer that we use to run the 3D software with.
So the hardware is impressive, but really the software is the magic, isn't it?
Yeah, the software is the magic, but the software requires that crazy kind of hardware to give you the real shock and awe when you walk in and you can see all of the anatomy in 3D.
So you mentioned that there's a projector in the room. So how do the students see a three-dimensional object in the room when using that projector?
So that's a great question. We had to experiment quite a bit with different types of 3D technology. The current type that we use is what's called a passive technology. It's the same type of technology when you go to the movie theater and you watch Spider-Man or Batman in 3D. The projector has a variety of filters on it, and think of it like putting a pair of sunglasses on your 3D projector. And it's through that polarization process and through that polarized filter that the students then put on their passive 3D glasses and are able to look at the anatomy in 3 dimensions. And you have to be there to see it. It's really impressive how it jumps off the screen and comes out and grabs you. The students get a kick out of it, but really I hope they learn something from it too.
It really is pretty impressive. I know when you showed me the lab when I was out there one time, you put on the glasses and you can just see these images floating in space in front of you. And, even as you move your head, you can kind of get the sense that there's three-dimensional objects there. It really is a different experience than two-dimensional.
Yeah, so you did mention something that's interesting. When we sit in a movie theater, all of us try to go to the best seat that we can find. What about the guy that gets stuck on the very end of the aisle? Can he see the 3D as well as the guy who sits in the middle? So these are problems that we had to address when we set this technology up to teach anatomy. And I'm proud to say that we overcame it. It took a lot of people to create this. It was far from being my idea. It took a lot of people, a lot of IT people, and we'll talk to some of them today, especially Mike Kronenfeld in the library, who's really been invaluable in supporting us in the 3D endeavor.
So we have the 3D lab, but then we also have, I guess we call it a little bit more traditional wet lab where there's cadavers. And I believe we have those on both campuses, right?
Sure.
Yeah,
So let's go to Jeremy maybe and kind of describe the setup for what students use there as they're looking at the cadavers and how they're dealing with the cadavers along with the computer technology.
Yeah, so with 172 students at KCOM, we have 31 tables, 5 to 6 students per table. Each table has two computers and two computer monitors at the table, so we can run the online dissector and VH dissectors and other software program that we use, trying to link the 3D and 2D worlds together. Really, the setup in our lab is for full dissection. They spend many hours in there doing, picking through fascia, as they would call it, and discovering these three-dimensional relationships. One of the things that we play with, what's interesting about virtual reality technology, we go from 2D textbooks and that into a 3D world, and for us it's mainly the cadaver we're going 3D. For Arizona, they're using that software in their cadaver lab for the 3D modeling. But then as the physicians of the future, any physician, rarely do they ever get in there and get to see the inside of the body. Mm-hmm. Surgeons do that, but most physicians, they're going to interact on the surface of the patient as well as in medical imaging. And all medical imaging at this point is two-dimensional. So a CAT scan cross-section, an MRI image, these are two-dimensional images. So what we've struggled with is trying to get our students to take the benefit they get out of that 3D cadaver and take it back into what they're really going to utilize. And so we've been using a program called VH Dissector, and a lot of schools use VH Dissector as a replacement for a cadaver, but we're using it to try to draw that knowledge from the 3D cadaver back into the 2D medical imaging that they're going to typically utilize. And we did have I don't know if you guys can bring up that image, but we did have an image of what VH Dissector looks like.
So this is kind of what VH Dissector looks like from a student perspective.
Yeah, that's one type. This is so modifiable. You can pull up different types of cross sections and different images, but you can see on the right there's a 3D reconstruction of an actual cadaver, a person that donated their body, and they went through and created these images off their body. And there's also linked radiograph characteristics. So we can take these students through different types of slices, and that's the traditional slice that we typically do, is trying to link that cadaver on the right, not their cadaver personally, but that image, and with that cross section, so they can really apply and learn how to interpret these medical images that they're going to see even in their third year of their rotations.
So Jay, as a surgeon looking at this stuff, or a former surgeon, I guess, if you will, you're still a surgeon, right? Just not practicing as much. What is the impact of being able to kind of look at this type of two-dimensional image that you might see up on an X-ray light or somewhere else, with the actual cadaver right there, and then some other kind of 3D representation? Is there a different type of learning that can take place for the student?
I mean, you're really hitting on the crux of the problem. A lot of students will tell us that they're visual learners. I would argue that all of us are visual learners. And you really hit on the nail on the head when you mention that it's physicians that will use radiographs. VH Dissector, which we also use here in Arizona, is a great program to teach cross-sectional anatomy to medical students, because when they get out and are in their residencies, the way that physicians and PAs, nurses, the way that everybody sees anatomy when they leave medical school is through a radiograph, through a cross-section, through a CAT scan. What we've done here in Arizona is we have, of course, the cadaver, and immediately at the cadaver table, we have a large 60-inch touchscreen monitor where the student can bring up any of our programs and use it as an adjunct to learning the cadaveric anatomy. I don't think that cadavers are going to be replaced. I don't think they should be replaced. And I don't think our technology replaces them, but I do think that all of these tools that we use, and use them wisely together, they all serve as a powerful adjunct. And I think the students feel this. When I was in medical school, I was taught the classic cadaveric dissection anatomy. And you realize that the transition from looking at your three-dimensional cadaver and then taking that same information and looking at a cross-section is very similar to looking at a set of blueprints and then being able to visualize in your head what the building's going to look like. And most students struggle with that. One of the programs that we use here is called BodyViz. And BodyViz takes the CAT scan, which is usually given to the patient on a DVD or a CD drive, and converts that data into a three-dimensional object that the students can see when they put their 3D glasses on. So we can take that two-dimensional CT scan and recreate it into 3 dimensions down in our virtual lab. So it's a combination of dissection plus 2-dimensional imagery, and then taking 2-dimensional imagery and converting it into 3 dimensions. It's a lot of work to create a curriculum that works, but we're doing it slowly. We're getting there, and I think the students are appreciative of the efforts.
I wonder if there's not also some kind of a helpful transition moving from what has historically been more basic science oriented when you study anatomy to really clinical practice. I mean, as you're looking at the radiographs right with the traditional anatomy, like you were saying, Jeremy, in books, there has to be a mental shift that occurs there as well. Is there any evidence that this type of learning is more beneficial for students, or the impact is greater?
Well, I don't have any references in my head, but a lot of anecdotal characteristics of it pretty much point to the fact that if you can hang your hat on some clinical way of which you're going to use this knowledge, all the better, right? And so if it's just facts, thousands of facts listed in a row, you're not going to remember them. But if you put a story to it and you can apply it to that clinical setting, all the better. But I think with all this technology, the trick is, as educators, is trying to choreograph it so that it's not burdensome, right? Because you can throw 10 different awesome 3D programs at the students and all these other resources, but they don't know what to do with it if we don't choreograph it correctly. So like with VH, what we're always trying to do is make sure we're not overshooting them with way too much to do in it. So trying to keep it simple so that they can at least giving them the tools to make that jump, change that mindset to be thinking and constantly rehearsing that practice of going between 2D and 3D as they would have to do in real life. And that's the big trick in education, is giving them the right tools and the right repetition with the best, most efficient material.
I mean, you could really overwhelm students with all of the tools that are available.
Very much
that's
so.
a good point.
Yeah.
Michael, maybe we can kind of cut to you a little bit, and you can talk about the library's role and what some of the resources are that the library provides to enhance what's being done in the classroom.
Okay, Brian, thank you. There's a couple ways that the library tries to support, particularly the anatomy programs at the 2 medical schools. First of all, we try and facilitate the students' access from on and off campus to the tools they use that are web-based. Certain things like VH Dissector have to be machine specific, but the ones that are web-based, okay, the ones that are web-based, we can put together and so the students can all get to them. And to also make sure that the programs used in one school or the other are available in the other. It makes these resources available to the other programs that their students can come and review, and they can be used also in their teaching of anatomy. What we've done is on the library website, which I hope everyone, if they don't have it as your homepage, at least have it bookmarked. If you go over to anatomy resources, we've put together a page that brings access to all of them into one place. These are the interactive ones. We have Netter and Anatomy TV. I'm going to show you Anatomy TV, just 1 or 2 things in it. Winking Skull is a good study tool. It gives you different anatomy atlas images that you can put the labels on it or not if the student wants to practice identifying them. We also have a connection to anatomy ebooks that the library provides access to. And here, if you see on the right, we have a pretty good selection. In addition, Ackland's Video Atlas is used a lot in different programs, and we have an institutional subscription to that. These are videos. We have anatomy images through a tool called Team's Anatomy Book. And again, these are good ones to kind of study and review We have the Bates Guide to Physical Examination, which is not strict anatomy, but related to it. Then we have linking to some of our to resources that we think would be of particular relevance in the dental programs. Now, when you go into it, the one I was going to show you is Anatomy TV. Let's see. Now, one thing about Anatomy TV, it doesn't work. If you do the 3D option, I'm going to show you, that does not work on Chrome. But we have a number of different supplemental resources. So we have Atlas. We have a real-time Atlas, and that enables students to see the anatomy, and it takes a minute to load because there's so much content in it. But
it's great to have these tools available for the students, and
what
really
you can
for
do
instructors
here is
as well,
see
right,
for
Mike?
different images. You can add. There's the bones. You can add connective tissue. You can add nerves. You can add veins. I think you get the idea. You can go up closer. You can look at it from different images. And so it makes it a real nice way to view it. And then what you can do also is you can take pictures of when you've put something together. You can also get a URL that takes the image you have and makes it live, so that you can have your students all looking at the same thing.
Yeah, it's too bad, Mike, we're not seeing it on your screen, but you're doing a good job of describing it. We're not seeing it on the screen here.
Oh, so the share is not working?
Right. But that's okay. Just continue to talk through it. And actually, I want to kind of wrap it up with a question more about the future. And okay. Let's go to Dr.
Let me mention just one other thing.
Yep, you bet.
To supplement what they've been saying about the 3D capabilities they have within the classroom, well, not quite as powerful as that. Within that tool also has a 3D capability, a little bit lower tech, but looks pretty well. And we can give the students these glasses. And what they can do with that is they can review what they've done in the class from any computer anywhere in the world. And it actually does a pretty nice, the one I was just trying to show, you can do that 2D and 3D and go back and forth. And so it's a supplement for looking at the 3D for students when they're not in class and they want to look at it. Then go ahead, Brian.
Yeah, no, that's part of what I was going to say is there's a big benefit to students, not only from an instructional standpoint, what they're getting at class, but then also self-study too, to have these tools available. But talking a little bit about the future, Jay, you kind of mentioned, this whole idea of being able to visualize things in 3D. As you see the future rolling out, won't our students just have tools like this that they'll be using day to day in clinical practice? And how much of that is happening now?
So that's a good question. They already have some of these tools available in a hospital setting. And moving forward, I think the way that CT scans and radiographs are going to be visualized is going to be holography, using holograms. And I know several companies have been working on this technology. I still don't think it's going to replace the live, bleeding human being in the operating room to teach surgeons how to operate. Because one of the things that we find, and this was alluded to earlier, is there's the classic teaching of anatomy, then there's the clinical teaching of anatomy, and then there's the relearning that goes on when the student gets into the operating room, and then there's looking forward to the future. And I think all of these are just tools, and I think all of them supplement one another. It'll be interesting to see what Microsoft comes up with. I think they're working on a technology, HoloLens. Is that right? Is that what it's called?
Yeah, that's exactly right.
Yeah. So I think going forward, we're going to see more and more of this technology being used. And again, what we find, your question earlier was kind of intriguing, and that is, has anybody shown any benefit to this? So before we started on this endeavor, I did a tremendous literature search to find the answer to that question. And the answer is students basically get out of it what they put into it. It's all just a tool. If a student wants to use just pure cadaver dissection and learn anatomy that way, they can do it. We've done that for 100 years. If they want to use this holography, these HoloLens technique in virtual 3D, body viz, if they want to use VH Dissector, which is a wonderful program, and they want to just use this in a textbook alone, that works too. It just really is, you get out of it what you put in it. And ATSU has a lot of anatomy resources on both
and
campuses.
ultimately, isn't that true with any kind of education? I mean, really, you are the one who ends up teaching yourself or learning
I
it
think
yourself
that's true,
at some
especially
level.
in higher education. I think that's true.
Yeah. I think this is a great place for us to take a little bit of a break. So let's go to a break, and we're going to learn a little bit about using Excel and putting or Microsoft Word and moving text into columns. So we'll take a quick break, and then we'll come back after the break, and we'll talk a little bit more about simulation and kind of how simulation fits into more opportunities for students to do some hands-on learning. So let's go to the break.
Hello again. Today I would like to tackle a word feature, columns. When trying to format text into columns, many people get frustrated when too much or too little of the text turns into columns. I'm going to show you a way to make sure your columns turn out right the first time. To begin, click on the Show Hide button. This button allows you to see some of the background things that are going on in Word. Now, click before the paragraph where you want the column to start. Click on the Page Layout tab. In the Breaks section, choose Continuous. Then, click at the end of the paragraph where you want the column to end. Add another continuous section break. Click anywhere in the section where you want the columns. Click on Columns, then choose the number of columns. On the Home tab, click on the Show Hide button to turn it off. Please feel free to email me if you have any questions, want further instructions, or if you have suggestions for further episodes.
Welcome guys, this is a quick video on 5 ways to prevent viruses getting on your computer. So the first one is, of course, you need an antivirus. You can get an antivirus like Kaspersky, Norton, Avast, anything like that. They're all really good. Secondly, when you get an email with an attachment on it and you don't know who sent it, do not open it. It can contain viruses, so do not open attachments that you don't know who sent it to you. And the third thing is, don't go onto any weird websites. There's a lot of weird stuff on the internet, and most of the times you'll get like a sixth sense of this doesn't seem right. So don't go onto any of those websites. And the fourth thing is, do not download any stuff from websites you don't know are secure. So we know like Microsoft, any thing you download from Microsoft's website or Apple's website, those are fine. But websites you don't really know, you should watch out for those, because sometimes they will have viruses on their downloads. So, and the fifth thing, also very obvious, keep your OS up to date. The people at Windows and Apple will bring out security updates regularly, so get them. They'll help prevent you from getting hacked or getting viruses. So update, guys. And that's it for 5 ways to prevent you from getting viruses. Hope you guys enjoyed it, and I'll see you guys later. Cheers, guys.
All right, and we're back. So today we're talking a little bit about technology and teaching, and we've talked a little bit about using anatomy and 3D imaging and how we're integrating that into the curriculum. And now I want to shift gears a little bit and talk about a different type of technology, which is simulators. And we use simulators really in several of our programs, dental and the medical programs being two of the most common. And I think let's start with a little video that I think is of the dental program out in Arizona, but it's really a good overview of how we use simulation at both schools. So let's run that video.
The Simulation Center at the Arizona School of Dentistry and Oral Health is comprised of 3 adjacent rooms: the control room, the simulation room, and the classroom. The simulation mannequin is operated from the control room. The instructor is able to control the simulation mannequin via Wi-Fi and has the ability to see inside the simulation room through a one-way glass window. The controller can speak through the mannequin, adjust vital signs, close and open the mannequin's eyes, cause the simulator to shake, sweat, cry, have a runny nose, and even drool. All the actions taken by the student are registered on the instructor monitor, and the instructor can provide immediate feedback on the student's actions. The simulation room houses the simulation mannequin and all necessary medical equipment. All scenarios take place in this room. The students involved in the emergency simulation are unable to see behind the glass and are unaware of who is controlling the mannequin. Cameras are located in the ceiling and feed live footage of the simulation into the third room of our simulation center. The classroom is equipped with a large projector that displays the simulation as it is happening. This allows for only a few students to participate with the simulator, while a large group can observe via live video feed. Once the simulation is over, the participating students and all instructors congregate back in the classroom and engage in a group debrief. All scenarios are recorded and later emailed to the students who participated.
All right, great. So that gives us a good sense of kind of how the simulators are set up and some of what we do to use them. Klud, maybe you could take us into a little bit more detail and talk about what you guys do at ASDOH with the simulation.
So we start really early with technology at ASDOH. During the first year in their lecture hall, we use Echo 360 to record all the lectures for them, should not be able to be in a lecture. They use iPads to take all their exams. Also, in the beginning of their first year, we use a technology called the 3D Tooth Anatomy Atlas, which gives them sections of the teeth so they can visually learn the dental anatomy. Moving to the semi-clinic, we have the simulation units, and I don't know if you have the pictures for that, where the students learn how to do the basic procedures, dental procedures, using tapedones, which has plastic teeth, and they learn how to prep teeth, restore them, how to control using the hand pieces in the mannequin head, which resemble the human, give them more experience to learn how to do that. At the same time, in the semi-clinic, we have podium where have all the learning tools that we help the students to show them demos. There's screens all over the sim lab. Any demo will be done on the podium. All the students will have visual can see that clearly. Besides, they have their personal screen. Also, we have an intraocular camera, so instructor can work from the podium using the intraocular camera doing demos, so it will be the same position that the students are sitting and the same tool the students are using. For the last few years, we have incorporated the CAD/CAM technology, which is on the screen now, which is students start taking digital imaging of their prep, and then we can send it to the lab electronically, and then the lab can fabricate the restoration and send it back to the students. Currently, the students are with the lab doing that, but eventually when they graduate, they can communicate with the lab through email, sending the image, design the tooth preparation, and then they can design the restoration and send it back to them. Currently, we've purchased also for this CAD/CAM technology what we call a prep check. This is a way the students will be able to prep their own teeth, take image of their prep, and evaluate themselves. So we will have a master prep, which is the ideal preparation, and the students will evaluate their prep according to the master prep. And we feel this is give them more critical thinking and good self-evaluation. Recently, for the last 2 years, after the experience we had with the medical school, we start using the simulation mannequin, which is the video that you watched, guys. And our first experience with the medical school was great, so we decided to get our own. Currently, our first, second years dental students, we start expose them to the simulation mannequin, and we have scenarios, which is the most common medical emergencies that you have in a dental setting. The students will learn how to identify the medical emergency, how to deal with it, and what to do. So they feel more comfortable when they go to the clinic. And actually, that was the feedback from students years ago. Said, "Oh, we could graduate without any medical problem that we see on the dental chair." And then they go to external rotation, and they might not know what to do. Now they feel more confident. We've done surveys before and after. For class, we started from the first year, second year, third year, and now they're their fourth year. And you can see from the data that we have from those surveys how the students gain more confidence and they feel more comfortable dealing with medical emergencies. And actually, we also interact with the doctors from the DO school who kind of brought the students like, okay, you need to know what you ask. They help them to identify and what to do at the right time. So these are the things. Future-wise, we're looking at more technology. We looked at something the other day, which placing implant through a screen, like a CT scan of the patient, and you place the implant just like they do any other surgery while you're looking at the CT scan of the patient. So that's the last thing we looked at.
That's great. Well, let's go to one of our students and ask him. So, Ethan, do you feel more comfortable as you're using the simulators to practice on things, and what types of scenarios do you go through?
Sure, I feel more comfortable, most definitely. The types of different scenarios that we use the simulations for, you can use them for emergency scenarios, critical care, just talking to a patient. We use the scenarios for time of death, calling something, and then presenting that information to the patient's family. It's definitely good exposure for us. And we, being on staff now as a medical education fellow, we try and encourage the first and second year students to use it as much as they can. There are some required things that they have to do in the simulation lab, but most of it is up to them. It's extracurricular. And the ones that do use it often, we find really, really appreciate what they experience.
Sure, so they've got the chance to do things over, kind of remediate those areas that they feel uncomfortable with.
Sure, definitely. Really, it's limited to their schedule. If they have free time and the lab isn't being used by anything else, Lisa Archer, who's one of my bosses, who's in charge of the simulation lab, is always willing to open up the colonoscopy, bronchoscopy, endoscopy simulations, the birthing simulator, as well as the incubation simulation for the infant, as well as the SIM-G or SIM-Man 3G life-size mannequins that I think we have 8 of those. So there's plenty of opportunity for the students to redo.
I would think things like intubation would be a great practice.
Yes, although it is a little more difficult from what I've heard just because it's hard rubber. But I've heard that if you can manage to do it on these simulators, it transitions really well because you can actually move an actual patient's head around and get the tissues out of the way. But intubation, glide scopes is another thing that we're doing. CPR, any type of hands-on stuff, short of actually opening the patient up and doing things like that.
I think it's a great use of the type of technology that we've got available for the students. Klud, maybe you can help us a little bit on what the dental students see as the benefit before they're actually working on patients.
Yeah, I think it's hard to work on a human being. I think that they get the training because they come to dental school with no skills, and most of those learners are visual learners. So we training them on a simulator before give them more confidence and better skills to take responsibility of working on a human being. definitely, I mean, you cannot throw the students in the clinic and, hey, go ahead and start, just show them picture and start on a patient. So improve their clinical skills, especially with a program like our program. Our D4 students, they go out on rotation. They see many patients in the external rotation. So they have to have great skills and certain hand of skill and speed to be able to finish more than 2 or 3 patients a day. So the students' feedback is always great, and even when they go to the clinic in the beginning of their 3rd years, we see them on their free time. They show up in the sim lab. Can I practice for a little bit? They practice the procedure. Let's say they have a little bit more complex procedure the next day. They practice that procedure on the typodon before they go and do it down in the clinic on the patient. It's improved definitely their learning experience, and I guess with the new generation, when we start teaching them this CAD/CAM technology, it's more like a video game. I mean, it takes us as a faculty much longer to learn it. You see, after 1 hour, they start teaching each other. Once they figure what button to press and to get the design done, how they draw the design, you will be fascinated how fast they learn these things, much better than reading a book, to be honest.
And Ethan, are we using them for more than just procedural type things? I'm thinking, so all of these rooms have cameras in them and they record all of the monitor settings and whatnot. There's actually, it seems to me, a way to think or to train the thinking of a student as they're looking at so many different things and how to take a history and physical. Are those types of scenarios also used here?
Most definitely. We have standardized patient encounters with real patients to a lot that enforce their history and physical skills. But when we come into the simulation lab with the mannequins, Dr. Schrant, who's an anesthesiologist at the hospital here in Kirksville, works really, really closely with Lisa and the medical education fellows to build cases for the students, so when they come in, they have no idea what's going on, so they have to start asking questions to the patient, and the operator, which is me or someone else, will speak through a microphone as the patient to provide whatever information they need, making it as lifelike as possible.
That's great. I think it's a great combination of technology, not just in the simulators, but the recording and then the ability to give feedback to students, and even to integrate it with more of the other curriculum components, where you might have more clinical type settings that can be embedded with basic science type concepts. So I think it's great. Anything else, Klud or Ethan or Jay, Jeremy, that you guys want to talk about before we go? The next section that we're going to go to is 3D printing. And we'll do a little segment on kind of how we're using the 3D printers as another form of technology and teaching. But anyone wrap it up?
I wouldn't mind chiming in with the fact that one thing that we usually talk about in anatomy, that half of the benefit of the lab is not necessarily the content, but it's the communication skills they build. So, the physician's the most effective if they can communicate effectively, listen effectively, and be part of a team. So the SIM lab, I think, does that as well, and in many ways probably better. Doing that.
On that, something I wanted to mention, so I'm glad you gave me another opportunity, is we're really trying to push interprofessional interaction in the simulation lab. The Truman State nursing program on a few different occasions, and we're trying to make it more so common, have come over and actually interacted, gone in. A nursing student has gone in the room before a medical student, gotten whatever information the nurse would need to get, and then they have to pass it along to the medical student. So we're trying to build their skills as far as getting out into the real world, because we teach them how to be a doctor in school. We don't teach them so much how to interact with every other profession that they will interact with.
Good point. Good point.
I just also want to add, we've just purchased software which is teaching biomedical through clinical cases. It goes by the system. So let's say we have the cardiovascular system. There's a case and you will see actors interviewing a patient. At the same time, it's explain how the basic science is related to apply the knowledge from the basic science to the clinical situation. I think we purchased 35 systems, and we're going to start using it with our second-year dental students.
Excellent. Well, Go ahead.
The other
sorry.
thing I may add real quick too is that the library, using technology, has just launched a library app, clinical app, which is aimed for the students in their clinical setting, and the setting to look things up really quickly. For example, one is a book of quick overviews of medical emergencies, so the student can look up in the dental setting if there's a medical emergency, and another one relates to oral surgery or some other technique, so that before they go in and actually do the technique, they can review it to help make it more effective also.
Good point, Mike. All right, let's go and do a video on a canned segment that we've got on the 3D printing, and then we'll kind of come back and wrap it up with some last minute thoughts.
Today we're talking to Seth McIntyre. He's a first-year DO, KCOM DO student.
Yes. Mm-hmm.
Welcome to the show, Seth. Mm-hmm. So today we wanted to kind of talk a little bit about the 3D printer and 3D scanner that we have at ATSU now. And I guess this all got started through the Spark Tank competition. Can you tell us a little bit about what gave you the idea for 3D printing for your Spark Tank submission?
Yeah, I was always interested in 3D printing. In undergrad, I was part of a club where we actually had 3D printing. And then over the summer, I heard we actually had a 3D printer, and it was free to students to use. I mean, just printing in color costs money here, so just having free material, I wanted to get involved. So at the time, I had an MRI from one of my friends, and he was like, can you extract like the brain out of that MRI and print it for me? And I was like, well, I think I can. So I started using just free open source software, and I got used to looking at the MRI scans from the different views, and I was able to take it out and then print it with our 3D printer here. And from then I got more and more involved with printing because it wasn't being used that often, and I got to know the staff here, and I just became more involved in the daily use of the printer until Gene Sidwell in the library said, well, you should apply for this grant. It's coming up for ways we can integrate maybe this into educational purposes.
So Seth, tell me a little bit about how these are being used in the classroom situation, these models here.
So in the library, we have a showcase of the different models. Here are some of the models that I've actually printed for students to use for their studying purposes. So in the middle, we have a partial skull. In this case, I took a model that was of a human skull, and I took a section of it out. In that case, we could look inside and actually see where the different nerves run in the different foramen inside. And then I also took bone from that specific model, sphenoid, and I enlarged it so that they could not only tell where it's in relation to other bones, but then also study the different parts and components of that specific bone. And then other models we have, such as the one to the left of the skull, that's of the cervical vertebrae, 1 through 7. In this case, you could actually get a good understanding, palpatory-wise, of how they move in relation to each other.
So there's probably lots of ways, lots of classes this could be utilized in, OMM, anatomy, I mean,
yeah,
kind of lots of places.
What's really interesting is the NIH 3D Printer Exchange has a heart library that they developed for like congenital heart defects. They have all these models. So what we're trying to do now is get those models for specific ones that we cover in pathology and other courses and print them out so students can look at them from different views, and then also see the different abnormalities in a 3D setting. You can print basically layer by layer, like 17/100ths of a millimeter. And I can print pretty intricate models. So prior to this, I didn't even know what the correct format I needed for this printer. It was more like learn as I go.
Yeah, it's definitely cutting edge technology, and it's really exciting that we have it available here at AT Still. Maybe we could go to some of the pictures of the setup we have. With the Spark Tank competition, we were awarded the 3D scanner, which maybe you could explain why we need the 3D scanner.
The neat thing about the 3D scanner is that we can take objects or even models that we already have. We can create a 3D rendering, digital rendering of that. We can view it online, take pieces away, extract certain pieces and enlarge them, and print them for student use. On this picture, it's a sphenoid bone, and we're going to scan that and print them for students to learn the anatomy of them, because we don't have many models of this. They can also probably view it or can view it on their iPad using free software to view it digitally. Yeah.
So it gives them a real tactile kind of, I mean, they can put their hands on it, really feel it. I mean, it's...
Instead of looking at like a 2D image of it from different angles, they can feel it, they can look at it, they can be like, oh, what does it look like from this angle or this angle? I mean, digitally it gives you, there's software out there where you can look at things digitally in a 3D space, but when you're actually physically being able to hold it and look at it, the size difference, different other things, and its orientation in space makes a big difference. Yeah.
Very good, very good. Yeah, so the... we're looking back at the model or the scanner again here, and I was just going to show some pictures. Does it use what kind of like lasers to measure the?
Yeah, so basically like it shoots out multiple lasers, and then it scans from the right side to the left side, and it's on. You can put it on this pivoting plate, and it can either do stationary or it can be changed to do like a 360 high def.
Does it move on its own, or do you have to move it?
It moves on its own.
Oh, wow.
So it takes about an hour for it to scan, and then after that you can orientate it and line it so it pieces together into one model.
Oh, okay. Yeah, I was taking the pictures of this up there, and I bumped the base, and I was like, oh no, I hope I didn't mess up the calibration or.
You can tell it's that's why we angled it towards the wall, because you can see the lasers. It's red.
Is there a calibration procedure you have to go through then when you set up one of them to scan then?
So when you set it up, it gives you observation window, and basically you need to make sure it's correct distance away from the scanner, and then make sure it's in the proper viewing range, and then basically from there you just click start and it's all automatic.
Very cool, very cool, very cool. So that's the process behind kind of, I'm going to scan through here a few of these pictures. This is all located in the Creation Station area of the library, a great resource not only for this, but they have computers there for video editing and whatnot for student use. Here's the Mojo, I guess is what they say, Mojo printer.
Yeah.
Our 3D printer here at the Kirksville campus. So the process then is to create the 3D file, I guess with the assistance of the 3D scanner, and then move over to the Mojo, load it up, and then kind of where does it go from there?
So basically we can either take a already created model that's in the STL format, which if you go to, there's sites like the NIH 3D Printer Exchange site, they already have a lot of these models we can just pull directly from, or if we're using the scanner, we can export it in the correct file format. And then from there, we pull it up in on the computer that's the 3D printer is using, and in there it automatically uploads that STL file into a viewing plate where you can change the orientation of how it's going to print and the size, so you can scale it up and scale it down.
So it's kind of how it positions when it actually prints. And so if I go back, or I don't know, Barb, do we have a video of kind of the printing process? This is it's kind of interesting. I have watched this a couple times, and so what it basically does is it kind of builds it by layers, like a cake almost.
It's like an inkjet, so it prints layer by layer. Each layer is 17/100ths of a millimeter, and that black plate is what it prints on. So you can print multiple prints on one as long as it is 5 by 5 by 5. And it basically, what it does is it uses this hard plastic that it melts down while it's doing the layers. And then depending on the complexity and the build size, it can take 4 hours to maybe even 2 days to print something that's very detailed and takes a lot of material. So once it comes out, you have support material that's overlaid the actual model itself. So it allows for you to print smaller, thinner models instead of if you didn't have any support material at all.
Mm-hmm. And in that, I think you have a tank that I guess it goes in and dissolves away the support material, and then you're kind of left with the 3D model.
Exactly. We have like a wash bath that we put it in, and we add in a solution that dissolves the support material away. So at the end, you have this model. Created.
Cool.
Yeah, and the models are pretty solid too. It's very difficult to break. Very good strength.
Mm-hmm. So how does one go about getting started? I mean, do they just contact the library staff to get like a primer? Or are you giving primers on it, or I mean, how does that work?
So in the 3D printing room, we actually have a notebook that you can request for certain things to be printed. In the past, we've had people say, "Well, I want the left hemisphere of the brain printed," or something, and then they put their contact information and everything when they would like it by. And then we try to find the model and print it. Sometimes they found a model online and they send it to us. Other times we just try to find one, or we try to extract it from either the 3D laser scanner or from medical images.
Okay, very good, very good. Well, it's definitely exciting, neat to see that we're cutting edge here at AT Still. We have some of the latest, greatest technology, and I guess if anybody's interested, feel free to contact the library and they can kind of get you started, move you in the right direction. And Seth, thanks so much for talking with us today.
Oh, thank you. Yeah.
All right, great. Well, I'm sorry, I just looked at the clock during the break there and see that we're over our normal time frame, so I apologize for going over. But hopefully, as everyone can see from the episode today, we just have tons of tools that we can use to kind of help people teach, help people learn, and it's really about getting the knowledge out there for those and hoping that we set off some light bulbs in people's minds on tools and techniques that they can use to improve either teaching or learning. We're going to come back in a couple of weeks with another session on competency-based learning. And so for that, we've got Dr. Ted Wendell and Danielle Kempton who will be with us. So join us for that. And again, thanks to everyone for joining us today, both in Arizona and here. Thanks for sharing the tools that you guys are using, the techniques that you're using. I think we've got lots of opportunity, and I'm sure that you guys would be open to anyone contacting you individually and kind of pointing them in the right direction on any of those things. Yep. So great. Thank you all. Klud, Jay, Mike, thanks in Arizona. Jeremy,
Thank
Ethan,
you.
appreciate it.
Thank you. Thanks for the invite.